This is Jared Stansell. I'm here to do a newborn assessment. For the vital signs, you're going to be checking their apical pulse, which is supposed to be 110 to 160. Then also you're going to be watching their respirations. You'll be watching their chest rise and fall for 40 to 60 breaths a minute. Then you're going to look for their axillary temp with a axillary thermometer, and it's going to be between like 97.1 and 99.5 Fahrenheit. Then you're going to check their blood pressure, make sure you have a small cuff, and systolic is supposed to be between 60 and 80. And then the diastolic is supposed to be between 40 and 50. Then you're going to be looking at their skin, checking for cyanosis or acrocyanosis, which is a bluish color, like in their hands and feet, because there's like slow circulation. Then you're going to be like looking at all their skin and making sure it's intact, no bruises or anything. Let's see. You're going to be looking at their hands for syndactyly, which is two fingers or toes fused together, and polydactyly, which is like an extra digit, so like 6 fingers or 6 toes. And the semi-increase, which means they might have Down syndrome, so it'll be in the hand right there or across the whole foot. The APGAR measures the activity, pulse, grimace, appearance, and respirations. So it's basically a score to tell like how well the baby's going to be able to survive outside the womb. The score of 0 to 3 would mean they need like CPR or resuscitation to help them survive. You might need to stimulate them a little bit if it's like between like 4 and 7, or just closely monitor them. Then like 8 to 10 is really good, and they're really likely to survive. So of course, like for interventions required, like between like 0 to 7 or so, especially 0 to 3 score, they'll definitely need help with their respirations and possibly their cardiac system. Let's see. Okay, and then the fontanelles. You have the anterior one right here. It's diamond shaped. It'll heal up and it'll come back. It'll fuse together in about 12 to 18 months. Then you have the triangular fontanelle back here. It'll heal about like 2 months or so. And let's see. Yeah, sunken. If you feel them, if they're sunken, means the baby might be dehydrated, or yeah, something's wrong with the fluid in their skull. So then, if they're inflamed or bulging, that could mean that they have increased intracranial pressure, which you need to closely monitor after that, how you find it. You're going to be looking at their face for stork bites, which are pink birthmarks. They'll go away on their own. You're also going to be looking for strawberry mangiomas, which is dilated capillaries in the skin. Let's see. You're also going to be looking at their back, down their sacral area, because there's going to possibly be Mongolian spots, which are like bluish gray coloration. That'll also go away on its own. Let's see. Then you're going to be looking at the Harlequin sign, which is like a deep red change in color of the skin. Like half the body is going to have the color change, and then half the body is going to have like a pallor. Then vernix, like that's the greasy white substance all over their body when they first come out. It's to protect the skin when they're in the uterus. Then there's milia, which is like these little pink pimple type things that will go away on their own. You want to make sure to teach the parents not to pop them. Then Epstein pearls, they'll have them in their mouth possibly, which is like a white or yellow pustule. they'll also go away on their own. Then umbilical cord should have 2 arteries and 1 vein. Arteries will carry away the CO2 and the waste products from the baby and send it to the mom to be filtered out, and then the vein will be sending the oxygen to the baby from the mom. And yeah, they'll be coming from the cord right there. Then the caput succineum. Don't know how to say that, but let's see. That's where it'd be like from a vacuum pump when the baby is being pulled through the birth canal. You might have an abnormal like cone shape to their head that'll normally go in on its own. And then cephalohematoma, that's like blood underneath the skin, in between the skin and the skull, just from trauma when it came to the birth canal. Then molding, it'll have some molding from coming through the birth canal, so the sutures might be overlapping, or the head might be abnormally shaped, which is it's okay because the brain is still developing and the skull is still developing. Let's see. Then for the reflexes, you're going to check their gag reflex, which of course you're going to have a finger right there. You can check their sucking reflex. They'll start sucking, and then if you stick your finger a little bit further, they of course choke. Then if you startle them a little bit, their hands are going to go out, and their legs are going to go out and then come back to the midline. That's the moral reflex. Then the Babinski reflex is like if you stroke your finger from the outside, their toes will fan out. That'll go away about a year old. Then the tonic neck reflex. It's when like if you turn the baby's head to the right, this side of their body will be flexed, and then the other side stay the same. Then the rooting, you stroke your finger or something along its cheek, it'll turn its head and try to suck at whatever's touching its cheek. And for respiratory distress, the baby's going to be grunting and having nasal flaring, and then sternal retractions. Just want to make sure you get help for that. Then you're going to be moving the hips up and down to make sure they don't click, and also looking back here at their gluteal folds to make sure they're symmetrical. If they're asymmetrical or the heel of the hip is clicking, that means they might have hip dysplasia. And then for the surfactant, it's important because it helps absorb oxygen and helps the alveoli to expand more. It's important for a gas exchange. And then the shunts in the heart, there's a foramen ovale that moves blood from the right atrium to the left atrium, instead of like sending the blood to the lungs. And then the ductus arteriosus, which sends it from the pulmonary arteries to the aorta. Closes up in 3 weeks. Oh yeah, and the foramen ovale closes up as soon as the baby's born. And there's also the ductus venosus, which distributes the blood away from the liver. That way the liver is not being used too much. Then there's 4 methods of heat loss. It's evaporation, radiation, conduction, and convection. the main ways to keep the body warm, the baby warm, is to dry it off as soon as it gets born. Make sure you wrap it up in a blanket. Have the room temperature set to a warmer temperature, and then have kangaroo care if that's available at the time, to have skin-to-skin contact. And for this, far the Ballard score, you're going to be looking at you're going to set the head straight and look at their posture. Make sure the spine is in line. You're going to be looking at the square window, which is moving the baby's wrist, seeing if the fingers can touch the forearm. And if they can touch the forearm, that's a really good score. You got to look at arm recoil, just like you bring the arms down, and then when they go up, that means they have a reflex, basically, of normal arms. Then a popliteal angle. You're going to raise the foot up like this. See how big an angle there is right here. Then the scarf sign. You're going to bring the arm right here. See how far across it goes across the body. The more tension there is, the older the baby is. And you're going to try to bring the foot as far as you can up to the ear. Then wherever it stops, that's where you take the measurement. And again, the more tension, the stronger and the healthier the baby is, and the older it is. So, let's see. All right, and you're going to be checking like skin and also genitalia. Make sure everything's normal. There's no hypospadias or anything. And that's the newborn assessment.